Hello, I'm Dr. David Green, CEO of the Florida Pain Network, where we connect those in pain with pain relievers throughout the state. Today the topic is, what exactly is a radiofrequency ablation? Well, it's been one of the most revolutionary procedures for pain management in the 21st century. And I don't say that lightly, because the problem with a lot of pain procedures is that they give weeks to months of pain relief. That's not necessarily bad by any stretch. Pain management procedures are non-operative, they have very low risk, and they're outpatient. But when you start getting into radiofrequency ablation, it is a procedure that has been shown to provide typically 12 to 18 months of pain relief. And that is impressive and unbelievable when you look at weeks to months versus 12 to 18 months. Okay? So let's look at exactly what's happening. Now this procedure, I call it radiofrequency ablation. It's also called other things like medial branch ablation, medial branch neurotomy, radiofrequency neurotomy, rhizotomy. Whatever the name for it is, it's the same thing. Okay? Now, and it does not involve radio, FM, AM, any of that. It's totally different. Okay? So here's the back of the spine. This is the lumbar, this is the sacrum. These bumps are the spinous processes that you can feel on your back. All right? These little joints here on both sides are called facet joints, F-A-C-E-T. They're about the size of a thumbnail, very small, but they have cartilage just like your hip and your knee. And whenever you move, you bend, flex, extend, that can be very painful if they're arthritic, okay? So you might say, it's so small, how can it cause that much pain? You'd be surprised. And if you have arthritis in one of those joints, you usually have arthritis in multiple, okay? So that's the issue. Well, what's the best treatment for that? Well, you don't want to jump to surgery because that would be elective and the results are not going to be what you expect. Especially if you have arthritis in multiple joints. What are you going to fuse the whole lumbar spine? It doesn't make sense. There's really not a good facet joint replacement like there is for the hip or the knee yet, okay? So you can get injections, which would be, one is called a medial branch block, and that involves a pain doctor putting numbing medicine below and above the arthritic facet joint, okay? That in and of itself can give 3 months on average of pain relief. If it works and then it wears off, typically the next step would be a radiofrequency ablation. And you can have that at multiple levels at one time, okay? And it's putting the needle in the same place. The pain doctor will numb the heck out of your skin and the soft tissue down to this area. And they'll put it in, the needle above and below the arthritic joint, and they'll provide thermal energy, radiofrequency energy, for probably 90 seconds at one time, very hot, and it will deaden those little nerve endings that are causing you pain. Okay? That can give pain relief, as mentioned, for 12 to 18 months. And studies have shown that if it wears off and those little nerve endings grow back, you can have it done again and get the same typical pain relief of over a year. That's why it's been so revolutionary. It's outpatient, it's very low risk, okay, and very effective. It can reduce the amount of medications you need, get you back to working, playing with your kids, doing the recreational activities that you want. Now check us out on the web at floridapainnetwork.com. We work with a lot of pain clinics throughout the state that offer both medication management as well as procedures such as radiofrequency ablation. All you have to do is click on pain management doctors, and then there's a drop down, or you can put your zip code in. Okay? I'm Dr. David Green, CEO of the Florida Pain Network. Your pain stops here.